So, hello, welcome to ComplyPlus Presents. Sorry we weren't here last week. We had a bit of a change to our schedule, but we're shooting two this week,
Yep.
so we'll be here again on Friday. But it's nice to come in the middle of the week for a change and see Taylor and the team. So, today we are talking about something a bit more topical. We will carry on our discussion from the train the trainer elements from the last episode, but as you all know, there's a rising storm in the health and social care landscape at the moment, and it's very topical, and that's to do with regulation of AI in healthcare. So that's what we wanted to discuss today.
Yep. God, there's a lot going on. It's almost like, where do you begin even? Because I think this conversation started right at the beginning of, when all of a sudden everybody is aware that there's AI because of ChatGPT, right? And then people are using it for all sorts, right? And and it's not only ChatGPT now. There's so many tools out there, but I use ChatGPT always because that's the perfect example, isn't it? Everybody knew what it was. All of a sudden, it's on the news. People are using it.
I think out of all AI, it's the buzz. It's the
Is
buzz,
buzz
one
one,
still, isn't it?
Yeah. So, and right from the beginning, sort of people started talking about regulation. So, say, look, we need to be really careful here that this is not a panacea. It doesn't solve all our problems just by itself. We need to think about how it's used ethically, and we need to think about regulation. And straight away, obviously, some people did not want to hear about regulation because obviously some people, they always use free markets, isn't it? You don't want to strive for innovation. Companies are perfectly capable of self-regulating. But obviously, that's quite different when it comes to healthcare.
Yeah,
Yeah.
exactly.
Because when I put my clinical hat back on, it's scary, some of the stuff that's happening out there. Absolutely scary. And if we dilute the conversation, because now it's a political conversation, it's a geopolitical conversation, it's a security conversation.
Ethical conversation.
Yes,
yeah.
then actually ethics gets relegated.
Well, yeah, because that gets in the way, doesn't it?
Exactly.
So,
When people start talking about security, when people start talking about countries threatening each other, it's because normally we watch politics happen and we sort of ignore politics in a way, just move it sideways and carry on. But I think for the sort of business that we are and the sector that we are in, you can't ignore politics the way it is right now. The megaphone diplomacy, and there's so many things that need to be sorted very quickly. That when you start talking about regulation, it gets diluted in the overall geopolitical priorities, right?
Yeah.
And I've watched in absolute shock and horror over the past 2 weeks the kind of language that is used, the grandstanding, the political. It's like politics above everything else, and it's quite scary. So I was kind of looking forward to this sort of conversation because I think it's important. I've started, you and I started putting this stuff on LinkedIn, engaging with people, and I think anyone in healthcare would be very cautious right now, and policymakers, regulators, the governments. We can talk about that a little bit more. But yeah, that background has been quite scary. Yeah.
Well, yeah, I think you've touched on a lot of the reasons why the discussion matters, and
Yeah.
like you say, in a world, or particularly here in the UK, where certain services are failing, people are trying to look at efficiencies,
Yep.
even business processes. Businesses have gained a lot from the introduction of AI.
Yep.
Some have used it well, some not so well. So you can see why, particularly in this country, but across the world, why people are keen to get AI in. But like you say, at what cost? And at what risk? And I know we're going to go through some of those things as we go through. So I suppose the first question really is to sort of say, to start on the other side of the argument, is to say why AI regulation in healthcare is necessary. Why is it necessary?
When you think about it, it's about why we are adopting it and what sort of elements we are adopting. Right, there's some things that are perfectly suited for artificial intelligence in healthcare. For example, I was following very closely the conference, radiology conference, at the beginning of February. Really interesting. Some of the strides they've made with AI-aided diagnosis tools for cancer and other conditions, because obviously radiology is all about diagnosis. It's been very advantageous, but they've used it very carefully. And even the Royal College here in the UK and others, or similar organizations across the world, they've worked together to create a framework. So it's a code of conduct in a way on how we're going to use it, how we're going to adopt it. Because obviously, if I get a misdiagnosis for cancer, for example, that's a huge mistake. Even if a human were to make that sort of mistake, right?
Yeah, of
you'd,
course.
you'd do a root cause analysis, try to understand what's happened and how we can avoid that in the future. But then if you do this mass adoption, blind adoption, it's worrying. So I guess in a way, right, you're saying, look, how is it adopted and what elements do we want to adopt for what use? I worked on clinical decision support systems. That was my doctoral research, right? Looking at clinical decision support systems and how they evolved from the late 1960s. I finished in 2015. And there's a lot of strides. But actually, there'd been an awareness for a long time that you can't just rely on decision support systems without actually testing them properly, without adopting them widely. And one of the biggest challenges actually was there was lack of adoption even of good clinical decision support systems. And that is a problem. Once we actually define what we're looking for, set the rules for how we use AI, and then look at the outcomes as well. So I said, what are the outcomes? We know what the dangers are. Then we adopt them in a controlled way, right? I was giving an example of drugs. I can't just develop a drug for hypertension right now. Say, oh, this is going to drop your blood pressure. There are so many hoops I have to go through to get even approval to do any testing at all on people, right? And there are defined standards around good clinical practice, as far as clinical research is concerned, randomized controlled trials, things like that, around the world. No matter where I am in the world, I'll know what the standards are. But we're saying that it's okay to go through such robust systems where, maybe about 1 in 20 drugs actually make it to market. But we're saying any AI tool that's going to impact clinical decision, we can let it through because companies can self-regulate.
And because AI is perfect, basically, yeah.
No. We need to think about algorithmic bias to sort of say, look, it depends on how it's built. Garbage in, garbage out, right? I can't just adopt it because somebody has said that the results are good. And there's an element of black box as well. I've talked to people sometimes that are trying to flog some stuff to us. You have done the same, where they say, oh, it's AI enabled and all that. Then you just ask them very basic questions and they can't even explain to you. And I'm sort of thinking, so how do we take this and tag it onto our system when you can't even explain what it does, when you can't explain how you've tested it, right? But actually, we're now saying, look, because there's a push for efficiency, which means there's funding cuts, because we then have to adopt these technologies to cover the gaps for the funding, then, we'll rush to do that without actually understanding what the risks are. You can't explain the dangers. You can't explain what you have done to get it to that stage. That's really a problem. The lack of oversight as well. What is the role of MHRA? What is the role of NICE in the UK? What is the role of the Care Quality Commission or other regulatory organizations? If we're saying it's okay to just adopt AI and we're leaving it to private companies that develop it, and then public and private organizations to adopt it without any sort of intermediary, and we're going to use them for clinical decision support, it's worrying. Then even when we think about cybersecurity risk, to say how many times has the NHS lost data or their systems locked up, universities.
Breached, yeah.
What if it's now AI enabled? What are the dangers? We don't even know what sort of dangers to anticipate at this stage. And also the other thing is, like I said, there are so many lessons from the development of drugs and medical devices for us to actually use with case uses that have worked perfectly since Second World War. When you think about it, the way we developed drugs from the early antibiotics in the 1950s, after penicillin to up to where we are, Yes, there have been a few drugs that have gone to market and caused untold suffering. Some of them had to be pulled off market. But we are saying everything that we've learned over the past 70 years, we're going to check it out just because AI is going to solve everything. It's foolhardy. I can't believe actually that politicians and serious people are ignoring the obvious.
The almost obvious risk.
Yeah.
But again, like you say, whose pockets is it lining? In different interests, conflicts of interest, and so on.
Yeah.
So, I suppose the geopolitical divide. Maybe start that bit again. Geopolitical divide on AI regulation.
Yeah.
So, obviously, there's been some conferences in Europe this month, actually, in February. So, your takeaways, I know you were watching this closely, even tuning in live and in certain aspects. What was your takeaways from that and your reading between the lines?
Okay, before the AI summit in Paris, that's the one you're talking about, isn't it?
Yeah, Paris was the main one, wasn't it? The
yes.
other one was in Munich.
Then the other one, the Munich one, was a security conference. But obviously, if you are saying AI is part of a security package, so you're moving from Paris to Munich with the same language.
Yeah, and motives almost, yeah.
Yeah. Look. You sort of think, I remember watching, because I was watching the conference live and following actually all the proceedings, even what's happening in the sidelines. I remember being completely gripped and thinking, I can't believe I'm hearing what I'm hearing, But it is what it is at the end of the day. If you compare, for example, last year, this conference was, the summit was in the UK.
Yes.
Rishi Sunak was still Prime Minister. Elon Musk came to that summit. And trying to build on Alan Turing and other people, that have worked in this area as a nod of respect in a way. The previous one was in Seoul in South Korea. I think there was continuity in a way towards some sort of agreed regulation across the world, just like we've done with the GCP, Good Clinical Practice Guidelines for Clinical Research. So I was kind of expecting something along those lines because the EU AI Act was already there. And it was very clear to say, look, if there are areas of unacceptable risks, then AI is banned. For example, you can't use AI for social scoring, right?
Yeah.
Depriving people, things like that.
Yeah.
Right. And the next level was the high risk AI, which needs to be regulated. And healthcare was right there at the top, hiring people and law enforcement, right? Yeah. Then the low risk was minimal regulation. You still need some regulation, but minimal regulation. For example, AI chatbots and automation tools, right?
Yeah. That we're seeing
that kind of makes sense
now, yeah.
And I thought that was actually a sensible start.
Common
sense approach. India had agreed to that as well. China had agreed to that. Then we have a new administration in America. We can't ignore that. And they are coming in very aggressive. The language is it's almost like a war zone type language in a way, declaring they refused to sign the declaration, and strangely, Britain, the UK government refused to sign as well, which I found really baffling. Because when I was doing my PhD, I remember one of the things when you looked at regulation, it was strongest in the UK and Europe, and even Americans were looking into UK and Europe to sort of see what they can learn, so that they improve regulation in their own jurisdictions. And now you sort of think, I don't know what the logic is of the UK government refusing to sign up, right? MHRA is one of the strongest regulators in the world. I worked in drug development where drug companies were desperate to get into the UK market, because if you get your drug approved by NICE, if you get a device approved by MHRA, then that's a rubber stamp to say if the British regulators...
It's almost like the standard in a way.
Yes, set the standard, the gold standard. And just like that, strange as well. If it had been a conservative government, for example, similar to America, you kind of would have expected that. But to think that a Labour government, considering what they purport to stand for, and I know it's not, I don't want to get political about it, but for me, that was one of the strangest contrasts contradictions, So to say, I never expected I'd see that day, Yeah. So serious discrepancies, there are huge implications, because obviously when they were talking in Paris, the conversation moved far away from any proved case uses. It was more about security now. It was more about political grandstanding and threats. I would say is the threat from within or from outside. Never mind all that sort of discussion. The UK and the USA are saying, look, light touch approach, and organizations should be able to self-govern using the current frameworks that are there. But again, I go back to that argument to say, look, it's going to be very different for healthcare. Transparency also is crucial. Legal liability for errors as well. For example, if there's an error, is it the doctor or clinician? Is it the AI company? Where do the regulators stand?
Because there will be cases, won't there? Yeah.
What about the service user?
There'll be cases.
Not that we're looking for blame, but actually
No.
there are standard systems that are in place now. Even the yellow card system, when there are issues with drugs, you can report to MHRA. And then they are monitoring, post-marketing monitoring, right? So the question for me is, when you have someone like Elon Musk in right center of the American government now, the current government, and he's also involved in AI development. He owns X, Twitter. There's a conflict of interest when you have these tech leaders. Even when they came to Paris, they're probably very happy now that they have governments, very strong governments, that are supporting their cause for free markets and less regulation. I don't know. Most of us will probably do the same if we're in that position.
Well,
right?
yeah.
I guess
It's going to work in their favor.
Yeah. Then obviously it's easy to say China. Oh, it's because state surveillance, the healthcare system is integrated with the state system, or even companies like DeepSeek. We're not going to trust them because they're coming out of China, or even companies like TikTok and things like that. But we are where we are. For me, actually, this was an opportunity to standardize how we do things. With China was in agreement, India in agreement, the whole of Europe pretty much in agreement, and South America, African countries were going along with that. It's left to America and the UK.
UK, yeah.
Strange world. Yeah. So there's a fallout from both the Paris Air Summit and the Munich conference as well, the security conference. It's now a discussion around security and geopolitics, rather than actually, for example, if you go to the EU AI Act, what it was about. It was about implications and practical regulation, which you can then continue to adapt, as AI sort of matures and we understand some of the risks, and we get some case studies to sort of look at and inform decision-making and policy-making. Yeah.
Yeah. So, what does this, what does this mean for health and social care providers then, where we are today?
Yeah, it's kind of scary. Maybe even you could come up with so many examples where people don't even get the basics sometimes of compliance systems, because we have incorporated some basic AI into.
Yeah. Even in some of the technology that we sort of provide for providers. I think obviously there's a bit of a stigma in health and social care where there's resistance to new systems, because even from some of the research you did
many years ago
now, and even some of the examples where we've gone into settings, different providers, whether it's private or public, you sort of see some of the systems still being used and that have only maybe even recently been adopted, but actually they're still quite old systems in the grand scheme of things. So I think, as much as AI regulation is going to be important, I think also managing the implementation of AI is going to be equally as important in a way, because to sort of say, some of these people have been doing their jobs the way they've been doing them for so long. How do you then, how's that change management process going to play out? Because we've seen, and again, even from our own examples, we've seen how change management can completely, derail an organisation, even getting it to the point where it can't function anymore. So I think I know the argument today is talking about regulation, but I think there's also that side of it as well, where there are a lot of people still in the industry who are very resistant to technology. Not just people on the ground floor, even people working higher up, even business owners.
Even NHS trusts as well.
Yeah, exactly.
Because I did my
Public
research
and
in
private
the
organisations.
NHS. One of the reasons why I didn't go back to work in the NHS was I just didn't fit in anymore, because I'd gone out to academia for nearly 5 years. I'd done some really interesting research. And when you think about it now, when I look at all the tools that we have, in 2013, 2014, when I was doing my, when I was finalizing my research, writing my thesis, one of the biggest problems was there were masses of data. I'm looking at just one teaching hospital in the country. Okay, granted, one of the largest teaching hospitals in the country. That's where I did my case studies. And I remember talking to the matrons and the clinical directors to say, look, are you looking at any of this data? Because we had decision support systems that were collecting so much data. And then I just took a few samples, and the way to analyze them was really difficult. I had to talk to some of the guys, statisticians at the university, to just see how they can help to analyze some of the data. But that data, a bit of analysis, there were so many things that could be improved, because it was historical data based on actual patient case studies. We were anonymizing this data. And when you look at the AI models that we have now, these are the things that were missing 10 years ago. And now they are abundantly available. They're so much cheaper. So that's a gain for me. If you were to, it goes back to sort of say, how do you make decisions about adopting any innovation, never mind AI? You're going to look at what you're currently doing right now. Then what is the relative advantage? If you go back to the diffusion of innovations theory, what is the relative advantage of bringing this new innovation? So we take AI, for example. Well, okay, look, we have so much data, clinical data, that we're not analyzing at all. What would be the benefit of analyzing it? Well, we could actually have a better understanding of this population, like our local hospital, more than 10,000 admissions per month into A&E. It's huge data there, huge data set in just one NHS trust that you could analyze and actually improve services, improve outcomes for patients. That is a good use of AI. Even laboratory results, even what's happened in radiology, actually really good. And it doesn't replace human beings, but it makes the radiologists work better, radiographers work better, because they have analysis tools that they can use. Remember, even during COVID, we were involved in training some doctors in China, incidentally, for echocardiography, where they were doing scans of the heart. So they were being trained to improve their diagnosis and decision-making, because traditionally that role was done by technicians. And actually the clinicians then were having to wait for the technicians. So rather than, there were some other things that technicians could do. So you fast-track the training of doctors. And there was some sort of AI enablement in the decision-making, because there were auto-generated reports. But actually, what you want, even any clinical decision support system, is to train the person so that they are competent. They know how to make that diagnosis, for example. Because an AI tool cannot see that the patient is sweating, for example.
Yeah.
Cannot see that the patient is
misses
pale,
the visual side of things.
right?
Yeah.
So there are still so many things that the clinician or the nurse or the radiographer can do, right?
And has to be able to do, yeah.
So it's about that analysis to say, look, what tools do we need? What are the organizational needs? What are the challenges that we have? How are we currently dealing with them? What is the relative advantage of different AI tools? We come up almost with a triage system, because in clinical services, we're very good at that. Assessing, actually, to say what needs to be done first. Then how do you bring it in within the current governance framework, for example? Because any NHS trust or hospital has got a clinical governance system, right? Even the private hospitals, they've now had to adopt the clinical governance system. Social care, not so much, because it's poorly regulated, I think, if you ask me, right? There's so many issues, but you can actually fast track that sort of improvement in regulation, right? And also enabling organizations to innovate within the framework, the current framework that is there, right? They would have to come up with their own system of assessing these tools and signing them off within the organizations. And the ethical adoption as well, to reduce that bias we're talking about, the liability of risks, safety failures as well. Then we are in the workforce development sector. We've been using AI for a long time.
Yeah.
It doesn't replace subject matter experts. We've been using AI tools for more than 10 years now, since we started developing these systems, and we keep increasing, but we've never used them to replace subject matter experts. We've never used them to replace organizational risk analysis and training needs analysis, but they can make it better, right? But we need AI literacy to train those decision makers so that they understand what they're doing. Then cybersecurity and data protection within the current framework, the GDPR framework and the HIPAA framework in America, I think there needs to be just some improvements, which when you look at the AI, the EU AI Act, it had covered all those things. It was well thought through. And I hope it just doesn't get chucked out. I think it's a good starting point rather than just saying, look, we don't need to stifle innovation. So for me, those are the challenges to sort of say, look, health and social care organizations, we need to really work at AI literacy, teaching people actually the basics of AI.
Yeah, and what it is, like you say, defining
Exactly, and how to adopt them safely. Because diffusion is going to be there. It's rapid because they seem useful. And then anyone now that you talk to, even when you look at LinkedIn posts, you can tell which ones people have done themselves. And the majority of them are AI generated. Just looking at the language, you sort of think, no, nothing new there. It's all...
Yeah, it's the way things are going, isn't it? Particularly, like, say, social media side. So I suppose, the final point on this is to sort of say AI regulation, it is inevitable. It's got to sort of happen, hasn't it? But I suppose it's going to be how regulated it is, what sort of strength, how aggressive, like you say, it's going to be, or how loose is it going to be. I think that is probably the argument, and what the argument is on both sides of the coin, really. I suppose from your side, is there anything else from a summary perspective from your side?
Look, I can't imagine any clinician out there, especially in the UK. I mean, I did my training in the UK. All my work has been in the UK. I can't imagine anyone out there wanting to just blindly take technology in. I think organizations with smart enough people will realize that, look, there's going to have to be frameworks within the clinical governance systems. In social care, like I said, the regulation of social care is got quite a lot to catch up, right? And again, organizations like CQC, the care inspectorates in Wales and Scotland, RQIA in Northern Ireland, I think they're going to have to catch up very quickly as well, right? You can't just let unregulated tools that are going to impact clinical decision-making or decision-making about people's care needs be done without any regulation. It doesn't make any sense at all. NICE is there, National Institute for Health and Care Excellence.
Excellent, yeah.
MHRA, they regulate the devices and medicines as well within the UK. They're strong institutions. No matter what the governments are saying, governments come and go. And what you don't want is 10 years from now saying, hang on, we could have done better. I don't believe that all these, especially in a state-funded system like the NHS, the European model, I think, is a very good starting point. I couldn't change anything at all, actually, when I look at the EU AI Act. I wouldn't even change anything at all. But that's me. When I look at it, even from an academic perspective or from a clinical perspective, it's a good piece of regulation, considering there was nothing at all in place.
Yeah.
Just like what we did with GDPR, it's needed, right? But now we're talking about, GDPR was about data, our data.
Yeah.
But now we're talking about our health.
And our health.
I don't think even our prime minister or the American vice president, for everything that they're saying, I don't think they'll want any unregulated treatments themselves. I dare them to say they'll take them. Right? I don't think they will do that. No. So it's inevitable. I think it's always just a lot of noise, political grandstanding, and it's diluting the conversations. And I think people like us, we're a private company in tech. We should be celebrating the lack of regulation. But I think companies like us need to speak loudly. So to say, look, although we could take advantage of this, rapidly develop tools and sell them, we're sensible people, we're ethical businesses, and we're going to look at the EU Act and see how we implement some of it into how we select our technologies and evaluate them before we deploy them. We're going to look at the ICO requirements. We're going to look at NICE. We're going to look at MHRA. None of the subject matter experts will say anything else. And a lot of the tech guys that we work with are already used to working within the regulatory frameworks. They're human beings as well. You don't want to go and have an operation that has not been proven to work, or take drugs that have not been proven to work and tested properly. Why would you want a technology helping to make decisions about your health without any regulation at all? Doesn't make any sense at all.
No. Yeah, so hopefully everyone found the podcast interesting. We'll be
Maybe depressing.
Wow. Interesting, depressing, yeah, want to flee the country, whatever it is. But yeah, I suppose obviously from our side, we'll continue talking about this on our channels. We've obviously got the ComplyPlus Bulletin newsletter now as well.
On LinkedIn.
And we've also got the one that Richard is writing, the Health and Social Care Observatory. So like I say, while it's very topical, and I imagine it's going to be for a long time, but at least for the next few weeks while we get the sort of, the outbreak or the outrage really from some of the things that have happened this month, we'll be keeping people up to date with any updates and new bits of news, or even new bits of technology that might be being integrated into various settings across the country, but also across the world. But like I say, as always, if you have any questions, we'll try our best to answer them. So please add your comments to the post when the podcast goes out on the usual channels. And we'll look forward to seeing you again on Friday.
Fantastic. Have a good week. See you soon.